Good afternoon. Today's video, I'm going to do a little bit on um, chat about patient assessments. The biggest thing there is to realize with patient assessments, you have to look for some of the injuries. If they're awake, they may be able to tell you where the injuries are, but there also could be hidden injuries that we may not be able to see. A good example would be a pair of jeans. A lot of times the blood will hold in the thigh area, say it was a femur fracture. There might be a unit of blood before it saturates that material and comes through it. So a lot of times the blood will hold that much, and if we don't look for it, you're not going to be able to find it. How do we look for it? Using our hands to assess the person. A lot of times I tell people we're going to start at the head of an adult and work our way down. The biggest thing there is you always start um, by what are we going to feel for? And everybody's like, how do you remember stuff? How do you look for things? One of the things I like is the remembering the word DOTS. DOTS stands for deformities, open wounds, tenderness, uh, and swelling. Deformity, open wounds, tenderness, and swelling. Um, you can feel it or see those type of injuries. So when I start at the head of the person, I'm going to feel is the head going to be soft or hard. And what I also do is every few seconds, I'll pull my hands out after I'm done the head. Pull my hands out. Look, is there blood on the gloves? Um, that's going to be important. A lot of times you may not be able to feel it, but if you may be able to see it. It's sort of what the military does with their blood sweeps. They look for those type of injuries. Um, and then I work my way down. Feel the neck, the face, push on the chest, um, push on the belly. Is the belly soft or hard? And when I do extremity, when I get further down, as I get to the legs and arms, the extremity section, I'm going to do one leg at a time, taking my hands and wrapping it around that leg, so I'm covering probably 60 to 70% of the leg and feel down the leg. But if I do one at a time, they may not be able to do one at a time. When they have pain, they're going to respond. If I do two legs, one hand on each, if they respond to pain, I may not be able to find it right away. So a lot of times, that's what I do. If this is a child, I always recommend start at their feet. Get down to their height or below them, so you don't feel like you're towering over them. Start at their feet and say, "Hey, I'm going to look for any injuries. If anything hurts, let me know and I'll stop." Don't tell them you're not going to hurt them, and then as you're feeling all of a sudden you cause pain, now you broke the trust value, and that child is not going to allow you to move further on to look for injuries. Um, One of the biggest things you can do is make sure when you're dealing with a patient is some type of gloves, hand protection for yourself. If there's a lot of blood, eye protection is going to be key, um, along with scene safety. Using what's around you, listen, smell, what do you see, which way is the crowd going, stuff like that to pick out, is it going to be safe for you to help that person, because a lot of times the bad guy or the person that caused those injuries may be in the crowd watching. Another thing I also do and tell people is when I'm talking to the person or trying to gather information is I use the word sample as another acronym. What I'll do is I'll ask them, do you have any signs or symptoms that they have? I write it down. Any allergies to medicine? Uh, any medications they would take or should be taking? Pertinent medical history, heart attack, strokes, diabetics, high blood pressure, anything like that. I want to know about it because that could affect how we treat that person and the injuries that may occur. Last oral intake. When's the last time they ate or drank anything? It's going to be another big one. And the last in the word sample is events. What happened up until this point? What caused the incident? Are they diabetic? Did they eat right? Did they drink? Did they hydrate? Stuff like that's going to be key. Um, and what I did is I'm going to try to hold this up so you can all see it. Uh, what I like to do is get an index card, and what I like to do is write down some key notes on it so that people can understand it. Okay, this is probably going to be backwards for use. I'm not sure if it's going to flip when it's on there, but to me right now it's backwards. But it shows the words thoughts. I use stick figures front and back so I can circle the injury. The reason I do that is I can circle where the injury was, so when I pass on my report, I know where it was. The sample's down here on the bottom portion of this paper, and I also try to get a name and date of birth. Name and date of birth is going to be key because when you go to register them in the hospital system, they're going to want to know that. Or if this is a disaster, just tracking the person who came through your site is going to be very important also. It's not the fanciest method, but it does work. I use it at work nowadays, and people look at me sometimes like I'm weird, but it keys me off on what to remember and what to do when I'm dealing with patients. Uh, so that's just real basic information on patient assessment. One of the bigger things I wanted to also discuss, I'm going to reposition my screen here for you, um, is realize that heart attacks. What's a heart attack? Um, and the difference between a heart attack and cardiac arrest. A lot of people misinterpret it. A heart attack is the blockage, which limits the blood flow, causes pain due to the lack of blood supply to the heart muscle. A cardiac arrest is totally different. Cardiac arrest is the heart no longer perfusing to the body, either stops or is not beating enough to allow perfusion. Um, Failure of the pump caused by sudden stopping effective and normal blood circulation. The biggest thing to remember is cardiac arrest may be caused by a heart attack. I'm trying to keep this on the basic level so I don't go too advanced for some people. So I wanted to make sure people understood there is a difference between a heart attack and cardiac arrest. It's very important to realize that. With any patient, you need to monitor them at any time. Talk to them. Even if they're unconscious, make sure you're talking to them. Because even if they're not able to respond to you, they may hear what's going on. Patients that are unconscious also do respond to pain. So if there's any pain stimuli, they may respond to that. So keeping calm yourself is going to be one of the biggest keys. And also remember, anytime you're dealing with medical emergencies, trauma, or anything like that, um, one of the big things I tell people is to remember people are going to die. You're not going to be able to save everyone. Um, but having the tools in your tool chest to be able to help somebody is going to be key. Knowing how to treat injuries, how to treat medical emergencies, how to treat environmental emergencies are all going to be key. Am I a wealth of knowledge? Absolutely not. Um, my biggest thing is I've been on the street for so many years. That's how I got my knowledge. I've been in EMS now since around 1990, 1991. Became an EMT about a year later, and I've been on the street since. So it's very important to realize that those emergencies can be overwhelming for any provider. New providers, old providers, street providers, whatever. But I want yous as the true first responders because yous are the ones that can make the biggest difference until help arrives. If nobody's doing anything until we arrive, that person may be dead. So if you can remember you're going to make the biggest difference, that is key to try to help somebody. So I want to thank you for listening. Um, if you want to know anything or suggestions on upcoming videos, let me know. I can't promise what I can do, but I'll try to take different subjects. I'm not going to promise I can do this every day because I'm going to be going into a 3-day work week with some other stuff going on this week. Um, so I always tell people, I'll try to post a video when I can. Um, so hopefully everybody will get a chance to pick something up as we go through this. And thank you for your time. Enjoy your day. Until another video, be safe.